I now give the floor to Mr. Ismail Ould Cheikh Ahmed, Special Representative and Head of the United Nations Mission for Ebola Emergency Response, to brief the membership. Mr. Ould Cheikh Ahmed is joining us via video conference from Freetown.
Thank you very much. Your Excellency, Mr. Kutesa, President of the General Assembly, Mr. Secretary General, Excellencies, ladies and gentlemen. Excellency, Mr. President, first I apologize for not being present in person in New York to brief this August Assembly, but I have decided to consecrate my first weeks to be visiting the field, so I'm addressing you today from Freetown. It is a pleasure for me to provide Member States of the General Assembly with my first briefing on the progress in the global Ebola response and the activities of UNMEER since I assumed the function of Special Representative less than 3 weeks ago. I arrived in the mission area on the 3rd January. Since that time, I have traveled to all of the affected countries, together with Special Envoy Nabarro and WHO Assistant Director General Aylward, as testament to our unity of purpose, where I have met with the President, with response partners and religious leaders and traditional leaders, with Ebola survivors and treatment care workers, and I familiarized myself with how far we have come in the response and how much farther we still have to go. Since the landmark resolution of the General Assembly on 19 September 2014, significant progress has been achieved in slowing and containing the largest ever Ebola epidemic. Only 3 months ago, the epidemic was ravaging West Africa, with 4,000 people infected that month and case loads doubling every 3 weeks. At the time, credible projection foresaw up to 10,000 cases per week by December. Thanks to the global response, this terrifying scenario has not materialized, and the devastating spread of the disease has slowed. The epidemic has turned, and we are now beginning to see an overall decline in the number of new cases. Liberia has recorded the sharpest decline, from average exceeding 300 cases per week in August and September to less than 10 cases per week today. In the last 3 weeks, only 4 out of Liberia's 15 counties have recorded new cases. With continued effort and vigilance and appropriate adjustment to the strategic emphasis, the goal of ending Ebola in Liberia is potentially within reach. However, the government is extremely aware that complacency must not thwart the progress achieved. While the number of reported cases in Guinea has also declined in recent weeks from 114 in the last week of December to less than 30 in the past week, strong resistance and even open hostility remain a challenge among many communities and is preventing access by response workers, especially in rural areas of Guinea Forestière, Koya, and Forakaria. Thus, a significant number of cases may go unreported. Sierra Leone, and in particular the western area, is still seeing the highest case incidence. However, thanks to the concerted effort of the government, the local communities and the international community, we are beginning to see a decline of new cases from more than 330 the last week of December to less than 140 per week last week. Indeed, overall, there are several promising signs. In the past 3 weeks, the number of new cases in Sierra Leone and Guinea has been at its lowest since August and late July last year, respectively. Liberia, it has been lower than even in June 2014. Mali has successfully contained its Ebola outbreak and announced on 18 January the end of Ebola transmission after 42 days since the last confirmed case tested negative twice. A large part of the progress achieved to date has been due to the effort of affected communities themselves. These communities have changed their behaviors and adjusted traditional practices that increase the likelihood of virus transmission, such as the washing of bodies of the deceased prior to burial. Thanks to active social mobilization efforts by national government and response workers, thousands of West Africans know now how to spot the symptom of Ebola and what to do to prevent its spread. The concerted effort of the international community, the United Nations, and its partners have also made a crucial contribution. The common threat posed by the epidemics has galvanized a truly global response. Donors have provided almost $2.5 billion in humanitarian assistance, and many countries have made available medical teams and logistical capabilities to support the response. I would like particularly to thank the African Union and ECOWAS for their initiative to deploy 835 skilled volunteers to the 3 most affected countries. I would like to thank the many national and international NGOs who are working to fight Ebola on the front lines, including running treatment units and centers. The whole UN system has been mobilized to bring to bear their respective expertise. WHO is guiding the medical response and training medical workers. WFP is making available its extensive logistic network and providing food aid, and UNICEF is supporting social mobilization. And these are only a few examples, Mr. President. It is truly a system-wide effort that is bringing the best of all UN entities to bear. UNMEER has worked to ensure that all these efforts are coherent and effective and support one government-led operational framework. UNMEER support the government in their role as crisis manager, identifying gaps in the response and redirecting the efforts of UN system agencies as required. UNMEER played a key role in supporting the Operation Western Area Surge in Sierra Leone, where additional bed and laboratory capacity needed to be deployed quickly. Thanks to UNMEER proactive intervention, 200 ETU beds could be scaled up to meet the needs within days, and more than 30 ambulances were flown in to support the response effort. Given its regional perspective on the outbreak, UNMEER continues to play an important role in fostering cross-border cooperation and supported the government of Liberia's redeployment of one laboratory from that country, where caseloads were declining to western area in Sierra Leone. UNMEER provides additional logistical capabilities to support the response. In Liberia, for example, UNMEER helicopters are ensuring that rapid isolation and treatment of Ebola team can reach remote area quickly. Similarly, UNMEER helicopters are also transporting blood sample for testing. Excellency, Mr. President, ladies and gentlemen, when it was deployed, UNMEER set itself ambitious targets for the Ebola response. It aimed to ensure that after 60 days of operation, 70% of all cases are receiving treatment and 70% of all burials are carried out safely and in a dignified manner. And after 90 days, the goal for both targets was 100%. At the 90 days mark, I am pleased to share that significant progress has been made toward these indicators. By 1st December, the 60-day goal on safe burial was achieved, and the goal on case isolation and treatment was achieved everywhere except for 4 districts in Sierra Leone. By 1st January, the 90 day mark, all 3 countries had sufficient capacities to treat all reported cases of Ebola and to bury safely all Ebola-related deaths. In fact, there are at least 2 operational treatment beds for every Ebola patient in all 3 countries, and a total of 254 burial teams are in operation. However, these capacities are not distributed uniformly across the countries, meaning that some affected districts have more beds than patients, while in others, numbers are insufficient. UNMEER will continue to work with governments, agencies, and partners to address these discrepancies and to ensure that these capacities are fully utilized. Stopping this outbreak will still require significant additional effort. The philosophy that will guide my approach, Mr. President, moving forward is defined by what I described as the 3 C's approach. First C is about countries. recognizing that national governments are in the lead and UNMEER and the international community are here to be an enabler for the effort of the government. The second C is about communities, understanding that the work at the level of communities to change behaviors and own the response is what will ultimately turn the tide. And the third and last C is about coordination. That better coordination among all actors is essential, and UNMEER has a key role to play in filling gaps through enhanced coordination at regional, national, and local level, as well as across borders. Implementing this approach, I see 5 key challenges for the Ebola response. First, we must strengthen our effort in social mobilization and community ownership. Too many communities are still refusing to acknowledge the disease and are resisting or even hostile to response effort, sometimes putting the lives of response workers at risk. We cannot win the fight against Ebola without the communities. Second, we must adjust our response to the evolving nature of the disease. While the number of overall new cases has come down, the disease has in at least one country spread across a larger geographic area than when UNMEER began. Thus, we must deploy dispersed surveillance, contact tracing, and early response capabilities to all districts, counties, and prefectures of the affected countries to be able to spot and contain a local outbreak before it spreads. This will require us to strengthen our field presence at the district level. In addition, we will need to develop additional mobile response capacity so as to be able to redeploy quickly where most needed. Third, we must foster greater cross-border collaboration in the Ebola response, including better monitoring of the disease and in the response in border areas, but with better exchange of information and sharing of response assets if needed. Any successes in containing the outbreak must be shared regionally among all the affected countries to avoid the risk of cross-border transmission and reinfection. Fourth, we have to start building safer and more resilient non-Ebola health systems and to address early recovery. While most of this work is outside the remit of UNMEER and falls within the mandate of the UN agencies, funds, and programs, where possible, the overall response effort should also contribute to ensuring the safe reactivation of health services and to building this resilience. For example, through knowledge transference of surveillance and infection prevention and control methods of local health care providers. I look forward to the findings of the Early Recovery Assessment Mission currently deployed in West Africa for insights on how we can ensure an integrated, holistic approach to this issue. Finally, we must assure that complacency and donor fatigue do not prevent us from reaching our goal. Despite the progress achieved in the Ebola response to date, the fight is far from won. Ebola continues to be a global threat. Every day, people continue to be infected and die of the disease. More than 930 new cases of Ebola and more than 800 deaths were recorded in the last 3 weeks alone. Additional cases continue to go unreported. We must remember that it took only one case to trigger this crisis. Going forward, I will do my utmost to ensure that we can address these challenges to stop this outbreak as quickly as possible. Finally, I would like to highlight to this August Assembly that the power of the images I have witnessed while I was touring the 3 most affected countries. Excellency, Mr. President, the battle against Ebola is about all the women and men in the front line, mostly volunteers. I was particularly touched by my visit to the Ebola Treatment Center in Port Loko, where I met Fiona from the NGO Go and her team of volunteers, and also my visit this morning to Bombali district in Sierra Leone, where I met Dr. John and his team of doctors and nurses from the African Union. I am humbled by the task entrusted to me by the Secretary General in heading UNMEER, and I hope to be able to count on your continued support for the global Ebola response. Thank you.
I thank the Special Representative and Head of the United Nations Mission for Ebola Emergency Response for his briefing.